Good morning, viewers. Merry Christmas and Happy New Year in advance. Welcome to Emac Online TV. Like you know, we always bring you programs that are beneficial to you. And today we will be having health talk. Like an adage says, health is wealth. When you are healthy, you are wealthy. I am Owode Ayodele Emmanuel. I'm a co-presenter.
Olukule Samuel Praise, aka Praise 247.
This morning we are having a medical doctor and a surgeon in our midst. And we are very glad that our guest is around. Can we meet you, sir?
Thank you and good morning, viewers. I am Reverend Dr. Adebayo Bolajoko. I am a retired plastic surgeon who had been in practice for about 35 years or thereabouts, and I'm glad to be here with you this morning. Thank you.
Okay, how did you achieve the aim of being a surgeon, sir?
Well, achieving the aim of being a surgeon is not something that happened overnight. As it's normal with most children, as they are growing up, they desire to be one thing or the other. So I was like that. I wanted to be a doctor when in primary school, but in the course of time, other things came up. I wanted to be an engineer. I wanted to be a pilot. I wanted to be... But the long and short is, by the time I was completing secondary school, I wanted to be a surgeon. And then, here I am today. We thank God for His grace.
That is good. Sir, what is the most challenging thing about what you do as a surgeon?
The most challenging thing, honestly, it's not easy to give one item as the answer to that question, because challenges are things that come up from time to time. In the course of my career as a surgeon, many challenges came up. Sometimes the challenge could be people you are working with, people, even the patients themselves. Sometimes the challenge could be finance. You want to do something, there's no money to do it. Sometimes you see a patient, a human being that requires attention. He doesn't have money, and there's not much you can do to help him financially in terms of, and you see some of them end up dying because they just can't afford to have the correct treatment at the right time. So you see, there are many challenges that will always come up. But by and large, if we're able to overcome the challenge, then, so most challenging thing for me is not one. It's been a number of different things at different times. But we thank God, everything has worked out well at the end of the day.
Okay, what is the most rewarding thing about what you do in the world of surgery?
Rewarding thing, that is a lot easier to answer, because the most rewarding thing for me as a surgeon in the course of my practice has been the pleasure that I received from the practice. You are able to do something that touched somebody's life, and you see the difference almost immediately, and even going forward, days, weeks, months, even years. Some of the patients I operated 30 years ago, you see them today, you are happy. So honestly, the most rewarding thing has been the pleasure, and of course, we give God all the glory.
Wow, that's wonderful, sir. But sir, in our society today, our religion, background, and beliefs, there is this traditional belief that surgery is not good, and whenever you book the patient for surgery, some people leave the hospital, they go and pray, some go and take this native medicine to prevent it, and at the end of the day they might lose the patient, and in this case they look at surgeon as their enemy. How will you advise against these things, sir?
Honestly, you are quite correct on that point. Many people, I'm glad you say beliefs. You see, what is belief? A belief most often arises from not cogent reasons, not valid, researchable points that you can say, yes, this is 98% correct. Beliefs oftentimes arise from lack of proper knowledge. Sometimes beliefs arise from fear of the unknown. Sometimes it could be somebody's bad experience and people are sharing that, and they develop opinions based on that. Yet, how correct are those opinions? You see, surgery itself is not a problem because human beings are the ones performing surgeries. So we can't say surgery is perfect. It has no potential problem of its own. Of course, no matter how good a surgery is, it is only good after you have finished it and the client is happy and no complications. So you can say, this is good surgery. But sometimes when some little thing or the other goes wrong, people use that to generalize and develop a stereotype that, surgery is not good. And then I'm glad you also mentioned the issue of faith, religion. Many people claim faith, but the question is, how genuine, how strong is that their faith? I've had pastors preach against people going for surgeries, and sometimes I laugh. And why do I laugh? I laugh because I look at those pastors as themselves not having enough faith in God that they are preaching. How is that? Look, maybe you should go back to read Genesis. Read chapters 1 and 2. You find that God himself started surgery.
Wow.
Yes.
Wonderful.
God himself started surgery. And whatever he had done, he said we should go ahead and copy what he has done. And Jesus said that what you see me do, if you really, really have strong faith, I will help you to do better. So if God started surgery, okay, how did he start it? The Bible records that, and God made Adam to sleep. In today's surgical parlance, we will say God administered anesthesia to Adam. So he made him to sleep. And that is where surgery starts from. The first process is to sleep. So after Adam had gone through the first process of sleeping, God now, according to the Bible, took a rib from his side. What does that mean? It means God opened up Adam, cut out a rib, closed back the place, and there was perfect healing. So it was what he brought out, the rib, that he used as part of what he used to make the woman. So today, don't we still do that? The surgeon goes in after the client is asleep under anesthesia, and he cuts, he repairs. And sometimes what he cuts from one, he can take it to another person to use it to do something. Of course, we do that a lot in plastic surgery. Yes, you can take a bone from somewhere and put it somewhere else. You can take a bone from one person and use it to go and reconstruct something in another person. So you see, God himself started surgery. So all we are trying to do now is, by God's grace, to continue the good work. That's all. So surgery should not be seen as a problem. And the truth is, many surgeons operate, I'm very serious about what I'm about to say now. Many surgeons actually operate under God's guidance. Many surgeons who believe in God and who rely on his guidance will tell you that sometimes they are operating and they know that the Spirit of God is with them, guiding them, sometimes giving instructions. Well, I know many people will find that difficult to understand, but then it doesn't matter. What matters is surgery is not a problem on its own. Just make sure that the surgeon is qualified, because that's another problem. Many people are doing surgeries today, but they are not qualified to do those surgeries. And sometimes that is part of the things that give people fear and wrong belief system, because there are so many charlatans out there who are doing what they are not qualified to do. So everyone should be careful about that. Go to the right hospital. There are different types of surgeons. You can have ear, nose, and throat surgeon. You can have a general surgeon. You can have orthopedic surgeon. You can have plastic and reconstructive surgeon. So if you have a ear, nose, and throat problem, don't go to a plastic surgeon. Yes, go and look for ear, nose, and throat surgeon. If you have a bone problem, go to an orthopedic surgeon. So you see, this is part of the problem sometimes that has caused people to have wrong belief system that surgery is bad. They go to the wrong person. Of course, you can't do the wrong thing and expect a good result. That is it.
Which means, sir, all the parts of our bodies now, all the organs we have in our system, they have different surgeons responsible for them.
For each of them.
It is not that all organs have a specific surgeon for each of them, but the way the human body is structured into tissues, organs, and sometimes they are interrelated. So that is what determines how the different classes of surgeries are made. For example, ear, nose, and throat, they are all linked together. So one surgeon works on that. The eyes, although it's in the head with the nose and with the ears, it's a system on its own. So you have a different surgeon for that. In fact, they call them ophthalmic surgeons, surgeons that work on the eye. Then you have general surgeons who work principally on different parts of the body. A general surgeon can work on the hand, can work and open up the abdomen to work inside, depending on what the problem is. You have plastic surgeons, plastic and reconstructive surgeons, who can work virtually on any part of the body to reconstruct, to remold. So there are different surgeons for areas of the body based on how the organs are organized.
Okay, we'll be right back after this short break.
Emac Online TV is here to provide you with opportunities to showcase your talents, business to the wide world. Are you a minister, music artist, comedian, school owner, business owner, and so on? Call or WhatsApp our marketing department on 080-5359-0094 or 081-0402-4042. Emac Online TV is here to provide you with opportunities to showcase your talents, business to the wide world. Are you a minister, music artist, comedian, school owner, business owner, and so on? Call or WhatsApp our marketing department on 080 5359 0094 or
Okay, you're welcome back from the short break. Welcome back from the short break. So, let's.
Sir, thank you, sir. We have been enjoying you as you are enlightening us more on her health.
Thank you.
Sir, what are your dislikes about your profession when you start? Do you later get to know that, I shouldn't have come into this profession?
Well, that question has some relationship with the previous question on challenges. As anything in life, no matter how good it may appear to be, as you go on, certain things may come up that will challenge you, your own belief in what you are doing, that may create some doubt as to, am I doing the right thing? Honestly, that is normal. And if I might venture to say, if you are doing one thing for quite some while and you don't have any doubt, any whatever to make you to look back and rethink, I'm not sure you are doing very well. Because even when doubts and challenges come, they bring with them opportunity to evaluate, opportunity to monitor what you are doing. And if you are opportune to do that, usually it means that you will have the time to start looking at, how can I do better? You'll see how far you have come. You'll see, maybe I didn't do the best here. You may see, okay, I did well, if I did very well here. But then, is there room for improvement? So, those are some of the things that challenges can do for you when they come up. The only thing is, as long as you have the interest of what you are doing at heart, honestly, the challenges, the occasional doubts that make you want to look back will only become opportunities to strengthen you to go forward.
Okay, sir. Now, being a medical personnel, how can we live without illness? Almost every now and then, especially in the generation we see divers of sicknesses, illnesses that they diagnose in the hospitals. So, what we want you to know is that being a medical personnel, how can we live without these things, without illness, without cancer, without all these things flying about? How can we live without them?
Well, it's a good question. But then, the question that question will automatically bring out from me is this: who are we? What are we? You see, once we understand that we are humans, a soul living inside the body. And what is the body? The body is just tissues, flesh, blood that has interconnectedness with the world itself. The air you breathe in, the ground you walk upon. The air you breathe in can bring in diseases to you. Yes, the food you eat can bring in diseases to you. So, to say, as human beings, how can we live without diseases? Honestly, I will say no. Honestly, it's not possible. Because the human body itself, no matter how strong you are, the human body like a car or whatever has a lifespan, and as you are growing older, the human body is getting weaker by its nature, its constitution. So we can't actually live without diseases and illnesses and whatever. But the big but is this, and I think that is the question we should be looking at. How can we make sure that we live the best we can? How can we become as healthy as we can be, thereby reducing incidents and occasions for illnesses, diseases, infections to the barest minimum? I think that is what we should be looking at. And the answer to that question is, well, it's simple, but it's not easy to put into practice. It all starts from knowledge. When we have knowledge, good knowledge, and we gladly put the knowledge to use, then it means we will have good control over ourselves, our bodies, and over the environment. Now, many people don't know that the commonest source of illnesses and diseases, especially in our own environment around here, is ignorance. Yes, ignorance. And what even makes that to become even more terrible is poverty. When I was in medical school, I was taught, after I left medical school, I saw it for myself that yes, truly, they say poverty, ignorance will lead you to diseases. And it becomes a vicious cycle. And look at it for yourself. Look at the people who are very rich today. How many times do you see them saying, I have typhoid? How many times? The people who are actually poor and ignorant are the people that we do things that will make them to have typhoid. And where does it start from? They don't have good toilets to start with. They go to one bush. They bend down, they finish. They just pick one paper from somewhere. They don't wash their hands. And as they come out, oh boy, they start shaking hands. The hands that he just used after defecating, he transfers germs to somebody else. And that one, as he's going, you see somebody selling guguru, you see somebody selling mango. He picks the mango, he pays, he starts eating. Meanwhile, the person who is selling the mango went to OJ market to buy, brought them to the house, they didn't wash. As they were trying to unpack the mango, the child was having diarrhea. The little baby was having diarrhea. She went to clean up the baby, just used the leg to pour sand on the diarrhea stool, came back to the mango to put it on her plate to sell. So you see, the child has dysentery. You can see from the stool is looking greenish and some blood there. The woman doesn't say anything wrong with that. Say, yeah, Belry. That's how they say it. And it doesn't matter. They just call one person selling agbo and one concussion they will give the child. Meanwhile, she has passed the organisms of from the stool, the dysentery organism to the mango. The person who just acquired typhoid organism from his friend picks additional dysentery organism from the mango. So two things are now combined. He starts eating. So ignorance is one of the biggest problems associated with poverty.
Wow, you have buttressed many points, and we appreciated that, especially for our people in the village, people living near
Not just in the village.
river,
Not just in the
near
village.
the river side as well. Most of them do not have toilets, so they believe they throw their
My brother,
defecation
it's
inside
not,
the
it's
toilet.
not just the village. even in town.
Even in town.
everywhere.
Town.
Even so, look, the truth is this: there are many challenges. As I was coming now, I passed by a market. In that market, how many toilets are there? There are hundreds of stalls. But how many toilets, I wonder, I sincerely doubt if there's a single toilet in that place. I don't know, I've never been to that market. But that is the, so that's why I say it's not just in the village. There is a stream nearby. Many of them will just defecate. They may not throw it into the stool, but when the rain comes, the rain will wash everything on the land downstream into the water. So it's not just villages. Even in town, are we not in a, we're in fact, we're in one of the largest towns in Africa. But then, the problem has many facets. Part of it is the people, part of it is lack of amenities. And that is where government can come in. Of course, when we now say government, there are different roles the government can play. Government can play the role of regulations. You can have, like this market now, I'm very sure that even in the local government, you have the hygiene department or whatever.
Yeah.
So they are supposed to come up with rules and regulations to guide markets. But then, somebody should have provided the toilets. Because if you say there is a department that provides rules and regulations, but there is no toilet, how are the rules and regulations going to work? So, and then, education. We need to educate people. Many people go to school. They come out with first school living certificate and the rest of that, secondary school certificate. But do they put into practice the things they have learned? Are you with me?
Yes, sir.
So you find that it's not just a simple problem. There are many facets to the problem. I see university graduates. They stand by the roadside. They are peeing. Sometimes it's not because they desire to. It's because they are pressed. There's no toilet around. No public toilet.
Yeah,
So they have to do it. So they do it somewhere. Now, not to talk of even these people didn't really go to school. Maybe they did primary 2, primary 3 before they dropped out. Look at all these touts. It doesn't mean anything to them. 10 of you may be standing. They will just do their thing right there. They don't care whether you are looking at them or not. So you see, there are many reasons why these things happen.
Wow, that's wonderful, sir. But sir, from my own side of view, though we cannot totally prevent all these things from happening, but we believe that gradually, through health talk, public awareness, we can eradicate this from our society. So what are the early signs and symptoms of illnesses that we can see? Because like now we are in the festive season, some people will travel home and they might have been infected with what they are eating, and they will believe that it is the daughter of the son-in-law that looked at the son, no, and after he looked at him, he has started stooling. He has their traditional belief has been having effect on what they ought to treat medically, and from this has led to many people's death. When they ought to go to hospital, they go to church or mosque or some traditional houses to pray, not knowing that they have been infected. What are the early signs and symptoms that we may see when we are having illness?
Well, thank you for that question. And it's actually a continuation of the last one we just discussed. Ignorance has a lot of role being played in the issue you just raised. when people are ignorant, sincerely, they don't even recognize symptoms. Because for you to recognize a symptom, then you must know that this is a symptom of something. Are you with me?
Yes, sir.
Now, for example, headache. Sometimes headache may not really mean anything. Sometimes headache can be a symptom of something. But because many of our people in their normal day-to-day life, they are not actually healthy. So when something is not right, they can't recognize it. Like somebody now who is always having some background abdominal pain in the belly. Sometimes they ignore it for days, for weeks, and it's like, that's how it is with me. They may not actually recognize that is a warning sign, a warning. That's an indication of something not being correct. So that's why I said sometimes when people don't know about occurrences of symptoms, they ignore the symptom. So it's a bit difficult for some of our people because of ignorance. But what I will say, generally speaking, is once you feel anything and that thing persists for 2-3 days, and you know that this thing shouldn't be, then that is a symptom. Ask somebody who should know and who can help you. Go to a hospital. People sometimes know that something is not right, but they don't want to go to hospital because they can't afford hospital. They see one malam carrying a bottle in which you have a clear liquid and another clear liquid below it, and the malam is hitting blum, 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 blum. They have a name they call it, I can't recall it now, and they shake it together. They give them to drink. They think we burn their throats, go down into their windpipe, into their stomach, and we burn. I say, the thing is working. You see, what they have just done is they have compounded their problem. Because what that man is selling is actually a poison. Yes, it is. It's poison.
Poison.
Yes, sir. It is poison. Because what he has put, that small one, that is a carbon compound. Usually it's a carbon tetrachloride that they put inside water. Because it will never mix with water. You see the two separate. So when they shake, you'll see droplets of the carbon tetrachloride being dispersed into the water. And that's what they drink. They feel the effect of the carbon tetrachloride as it burns them, and they think it is working. It can destroy their liver over time. They won't know. So they will not be saying it's one uncle that wanted to take their father's land. But the truth is, their ignorance made them to come to that point. That is the problem.
Thank you, sir. But also, sir, still on this matter, there are some people that whenever they visit the hospital and they make a particular complaint, the doctor give them drugs and they note the drug. Whenever they are now having such signs and symptoms again, they will still go ahead and buy the drug again.
Exactly.
Instead of visiting the hospital for diagnosis.
Yes.
Is that right, sir?
Definitely is not right. Definitely. And the reason is this. When you went to hospital the last time and they gave you a particular medication, you see, doctors don't treat symptoms. And that's why when you are with a good doctor, the doctor will, he or she will ask you different questions. The reason is the doctor is trying to find out this particular symptom, what is it due to? Because sometimes one symptom can be pointing towards 2 or 3 different possibilities. For example, cough. Cough can be just because you inhale some dust. Cough can be because you have something in your windpipe. Cough can, so the doctor wants to know. So if because the doctor gave you maybe some lozenges or something to lick the last time you went there, and you now went and buy one today because you have cough, that may not be the right thing to do. Pain. In fact, do you know that pain is one of the commonest symptoms that people can have? Yet, pain is one of the most difficult symptoms to use to diagnose by the doctor. Because when you just say pain, so that's why personally I've encountered that. Somebody comes and says, pain, I have pain in my stomach. And you say, oh, you have pain. Where exactly do you have the pain? Then you now go and say, okay, what type of pain? Please describe it. Is it a dull pain? Is it a sharp pain? Is the pain there all the time? Or the pain comes after some time, it goes away? The patient is like, these questions are too many now. And these questions are too many. I say I have pain, just give me something. You see, pain alone can be the symptom of 10 different problems. Pain alone in your stomach. So you see, symptoms arising from one disease can be similar to symptoms from but when the doctor looks at, maybe you have like 3-4 different symptoms, and he characterizes the different symptoms, that is when he makes a diagnosis in conjunction with the signs that he can find on your body. So symptoms and signs combined together are the things that the doctors principally right there in his clinic on the examination table or in the consulting room uses to arrive at potential diagnosis. Sometimes the doctor may have to send you to the lab. He may need to send you for an x-ray or for some other investigation, either to confirm his suspicion of a diagnosis or to disprove a diagnosis. But sometimes people don't realize that. They say, the doctor wants me to spend all my money, so they would rather go to one chemist. Meanwhile, the chemist is not trained. The chemist will just say, okay, you have pain. In his shop, he knows that 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 tablets can work for pain. So he just takes one to give you. Meanwhile, the kind of pain you are having, you shouldn't be using that particular type of medication. But you don't know. So, ignorance, poverty are still working together to make people do what they shouldn't be doing.
Sir, still on that, sir. We have chemists in our society, we have medicine store, we have pharmacy, and we have hospital. And you know, in our society today, all these facilities, they are bringing up themselves as a healthcare professional. Even someone that wakes up and learn medicine stuff, when they get to the environment, people started calling them doctor.
Definitely.
They started giving people different drugs without knowing the specific thing that is actually wrong with them. And when this thing gets escalated, they visited the hospital at the late stage. And at times they might end up losing their life. They will be like, the doctors there, they are not perfect, they are not doing well. When the chemist is taking care of them, they are still alive. They are not knowing that all these drugs have deteriorated some of their system. How would you help us to advise people against this so that they know where to go whenever they are healed?
Thank you so much. In fact, that is very important. Let me make an illustration so that people can have an understanding. You buy a tuber of yam. You take it to your house. After a few days, you notice a small spot. Say, this yam is like something is about to happen to it. But you didn't do anything, you left it. Maybe after like a week, you are now hungry. You don't have anything else to say, that yam, oh yeah, go and bring it. You begin to cut the yam. You now find that the whole yam has gone bad. That's exactly what you have just said. When somebody has a health problem, a health challenge, and he doesn't go to the right place for attention immediately, that health challenge will most probably continue to get worse. The day you now say, okay, let me go to the hospital, there is one thing about life. When something is going bad, there may be a point of no return. That if you fail to do what you are supposed to do, by this point, there is nothing you can do again, because it has gone beyond remedy. That's what they will say. Unfortunately, in our own environment, that is the problem. Most people wait until things have gone beyond the point that hospital can help them. For example, somebody was having pain in the lower part of the abdomen on the right side, and they were going to one chemist or pharmacy or whatever they call themselves. They were taking some painkillers. Apparently, the problem was simple appendicitis. But after like a week, they now came to hospital when the pain was now out of hand. When they were taking the pain medicine, it was like, the pain went away. Suddenly the pain came back. By the time the pain came back, they didn't realize that the appendix had ruptured. Now, you now come 2-3 days after appendix had ruptured. Appendix that are ruptured is no longer just simple appendicitis. It is now, because when the appendix ruptures, it allows feces in the gut to spread all over the stomach, all over the abdomen, as medical people will call it. And when that happens, permit me to use some medical jargon now, what the person will now have is peritonitis. Peritonitis is something that is no longer just affecting the abdomen. It affects the kidneys. It affects the liver. Eventually, it affects the whole body. So, simple appendicitis that if he had gone to the hospital at the right time, surgery would have been done. 2-3 days is perfectly back to normal. Maybe some little pain from surgery. But within a week, that one should disappear completely. And he should be able to go to his work, resume duty. Now, his system has become generally infected. So he now has what the doctors call toxic shock. And now they rush him to hospital. They expect the doctor to do magic. He can't. Because his organs, the kidneys, the liver are already failing.
They are affected.
Yes, they are already failing. And when they say fail, it means they can no longer do their normal duty. So, and when that happens, the doctor may not be able to bring them back to recover. So the person dies. At that time, they start blaming the hospital. They didn't take care of him. That is not the truth. The problem is their poverty, their ignorance brought them to that point.
Thank you, sir. Poverty, ignorance associated with time. Sir, there's this belief and the way we are going, all these, how do I call it, network drugs that people do sell here and there. That if you take this drug, you don't need to do surgery. The thing will shrink and you pass it through the feces. And some people will take it to some point. And at the end of the day, they will still go to the hospital. And the most saddening part of it is that when they go to the hospital, they will not even say the truth. They won't tell their doctor the truth that they've taken such drugs. They will just start telling lies. We don't do this, or we don't do that. It just started yesterday. Maybe something that has started some weeks back. It started yesterday. Yesterday. Things like, what are the dangers of this thing? And all these drugs that they are selling, is it alternative to surgery?
Well, some of those things they sell, these network drugs, actually there are different types. But by and large, most of them are just vitamins. When you actually look at what they contain, it's unfortunate that many of the people who sell these things, they mislead people. But then, it is also part of the problem of ignorance. Because when people are knowledgeable and somebody comes to you to sell something to you, you yourself, you will read what has been given to you.
What is that?
And you yourself, you can make your own research into it. This thing, what is it all about? That's why many of the people who are well educated, they can go online, even research. They feel they have a symptom, they will research it to have an idea even before they come to hospital. And that's why people who are better educated don't have the same kind of ignorance as a problem that other people around us have. So my own contribution to this problem is, let people beware of what they are being told. You must always remember that whoever wants to sell something to you, his primary or her primary motive is profit. And many people, in the name of profit, they will tell lies. Of course, even religion is against that. Genuine and true religion is against you making profit by telling lies. But how many traders believe that you shouldn't lie so as to make profit? So they are ignorant in so many aspects. And as I said earlier, I think I can't say it too many times, ignorance is the big foundation upon which many of the things we are discussing now rest. This thing we are saying, do they have such problems in Europe? Do they have such problems in America?
No.
The answer is no. Because the people are knowledgeable and they are always ready to find out for themselves what is the true position of things here. Is this correct? But most of our own people here, because of ignorance, they don't have that kind of approach to life.
Okay, so now, is it possible to be free from illness? Is it possible to be free from illness? Is it possible?
No, I think we had a question earlier on that is similar to this. It's not possible to be 100% free from illness. Because when you say illness, the term just means something is not going right.
Okay.
So illness, disease, or whatever. Even an accident, you bang your head against the door. It's an illness in a form because you'll have some headache. The place may even swell. So it's not possible 100% to be free, but it is very, very possible to control your atmosphere, control yourself, your life. You can be very, very free to a large extent. Most illnesses, as we said earlier, around here are things that can be avoided. Maybe I should say this. When we want to classify illnesses and diseases in the hospital, we say communicable and non-communicable. Communicable means the things that can pass from one person to the other. They can be transmitted. And what are these? They are mostly infections. They form the largest part of the problems. The things that cannot be communicated, they form the smaller part. The things that can not be communicated, cancer, hypertension, all those things, they will happen, but we can control how they happen. Although I said some of these non-communicable, although they can be transmitted through genes, like hypertension now. Somebody can inherit hypertension from one of the parents. You understand? And that's why when you come to hospital, we want to ask you, did your father, exactly, family history, diabetes? They can be taken care of, but you cannot entirely say, everybody will not have diabetes. Nobody in life will have hypertension again. No, you can't say that. The people who will have them, but once you recognize the problem very early, I know people who have sickle cell disease, yes, that graduated as medical doctors. They are in their 60s now. They are still practicing. I once had a patient who was a principal in one of the big schools here in Ibadan. If the man didn't tell me as he came in that, doctor, I'm a sickle cell, whatever, you may not even recognize, you may not know from him, because his parents knew and they took very good care of him. So he grew up, he was a retired principal, and he was looking well. Yes. Meanwhile, many of the people who have problem of poverty and ignorance, sickle cell disease, they will think it's one witch or wizard. They are running around. Meanwhile, even sickle cell disease can be avoided. You know you are AS. You know the person you want to marry is AS. Yes. And you know that there's a very fairly good chance that we can have one sickle cell amongst the children. You not make a decision saying, no, let us not marry. See, you've prevented it. It's a disease that runs in family. But because you decided not to marry AS to AS, you have prevented the problem. So you see how knowledge comes in now. So that's why I said diseases can be prevented to a large extent. Diseases that cannot be prevented will still happen, but you can take care of them, control them well, that they don't have to be problems destroying your life.
Obviously.
Thank you, sir. We want to celebrate our listeners that are listening to us. Hope you are enjoying our program. Before we close for today, sir, just one more question, like an advice. Sir, we want you to help us to advise people on the need to be visiting the hospital for regular medical checkup, and how often should they visit the hospital? Because I want to believe that if anything wants to happen and it is detected earlier, so the risk will be minimal than to keep it in the body for a longer period. Thank you, sir.
Well, the truth is this. People who have cars, once you buy your car, let's say you buy your car brand new from the factory today, is that how you keep on using it for the rest of its life? No. From time to time, you take it to the mechanic. They call it servicing. They change the oil, they change the filter, they change. That's exactly how human body is. And then as the car is growing older, brand new car, maybe the first 6 months, you don't even change the oil at all, depending on the make. But after some time, you start changing the oil, maybe once in a year. After some time, maybe twice in a year. After some time, maybe 3 times in a year. You see, as the engine is getting older, depending on the number of kilometers the engine has covered, the servicing schedule will change. That is the human body. 5, 10-year-old, 20-year-old, the body is still very good. You can't compare that to 40-year-old. You can't compare the body of a 40-year-old to the body of a 70-year-old. So you see, as people get older, they need to do more servicing of their body, so to say. And that is what we call medical checkup. Like somebody in the 40s, you want to find out, do I have diabetes now? Do I have hypertension? No, these are the things that you can look at and say, okay, go for some tests. Somebody in his 60s, you want to find out, yes, I'm feeling good, I'm feeling okay, but what is going on inside? Is there a small cancer growing? You can go to the hospital. They can say, okay, maybe you do x-ray, maybe you do maybe CT scan or whatever they want to do. Okay, let's do your liver function test. All they want to check is, how is your system functioning? And as they are doing that, they will make assessments and they can guide you as to how to go further. That is it.
Okay. Thank you, viewers, for staying with us on this program. I hope you have been blessed. Once again, this is Health Talk with our very special guest, Reverend Dr. Adebayo Bolajoko. God bless you, sir, once again.
Thank you.
So, I also like to use this opportunity for this more awareness of the program. If you have, I hope this program has blessed you. I hope it has, it has enlightened you more, and I hope with this knowledge that has been dispersed onto us, we will know when and how to check up on ourselves, our present health status, and I hope by now you know your present health status. All right. So for partnership, as you can see, the phone numbers are there rolling on the screen. For partnership, you can call us via WhatsApp call, video call, or the normal call. Then our email platform is over there. If you have anything to send to us, if you have any information for us that might be useful, you can send it to us via the email. Then we are also available on all social media platforms. That is via WhatsApp, Facebook, Instagram, YouTube, Twitter. We are there. We want to hear from you. We want to hear what you have for us. We want to hear your comments. Even on today's program, we would like to hear back from you. We would like to receive a kind of feedback from you, from our viewers. What you think is best, what you've learned, and what another kind of health advice you can give to our people out there. So once again, thank you very much. My name is Olukile Samuel Praise, aka Praise 247, and
my name is Owade Hayodele Emmanuel. Till we meet again, please note, health is wealth.